Hi everyone, today I'd like to explain you more about aptitude test which is required for the nurses who wish to come to Ireland. So it's a mandatory examination in Ireland to become a registered nurse in the Republic of Ireland. So mainly the structure of the test includes two comprises, that's part 1 and part 2. So part 1 means that it's a theory or knowledge test or multiple type of questions which must be successfully completed before part 2 can be attempted. So the part 2 is practical or OSCE test. So and only we have 2 attempts allowed for each of the 2 parts of the test, and this theory test must be repeated in full, and an applicant who fails at the first attempt of the practical part or OSCEs will be required to revisit the OSCE stations failed, and we must allow the sufficient time to prepare for the second or the final attempt, and a minimum of 2 weeks is strongly recommended. And the main thing which I want to inform you all is RCSI will not approve any training or preparation cost for the test, and mainly the contents of this test including. Next, I'd like to explain more about this theory test. It is the test which is consists of an assessment of professional knowledge and understanding, and it's a method of assessment known as multiple choice questions. So we have 150 questions over a 3-hour period. So each question will have 4 possible answers, and you're required to give only one answer to each question. And we require a minimum pass mark of 50% that has to be achieved in this theory test, and you will not be permitted to leave the test until 60 minutes has passed. So next we can discuss regarding the practical test, that is OSCE. So it is a methodology that is structured a clinical examination is used. So it's an acknowledged internationally as an assessment methodology that enables the applicant to demonstrate the competence in a simulated practice settings known as station. So here the assessment includes a number of different simulated stations. So in each station it's a setup as a clinical settings and has all the necessary equipments. So we are required to complete 14 stations. So each station assesses different competencies pertaining to general nursing. So each and every station has a descriptor sheet, and this is displayed both outside and inside the station, and it is also available for you to refer as you need. And for every station they'll spend 10 minutes at each station carrying out the care as per the station descriptor, and there are a number of aims and competencies that you're expected to achieve at each station. And in each stations there are trained assessors, that is the OSCE assessors are experienced nurses who hold a postgraduate qualification and have been trained by RCSI or OSCE assessors. In some stations they have a mannequin for the detailed explanation and the clinical settings, and the stations may have one of the assessors acting as a patient or as relative or a staff member. So assessors consider the applicant's performance and mark as pass or fail. So in order to pass the practical part, the applicant has to be deemed competent in each competency at each station. And then the scenarios for OSCEs, each station has a station descriptor sheet as I mentioned it before. So it really contains the scenario or the situation or the condition for the station. So this is available for both outside and inside each station, so it will be easy for you to understand what's the exact thing which you need to explain in the station. So the station descriptors may change from one test to the next, And the applicants are strongly advised to be fully familiar with these informations which they are included in the website, and including all the links. So if you're available, or if you're familiar with these links, so definitely you can achieve this examination. And it's recommended that all applicants practice filling in the documentation that may be used at the OSCEs. And obviously you'll get the next question, how we will prepare. So for every examination, preparation is an important thing. And of course we know that nursing is not just about knowledge, but it's also about the application of that knowledge to ensure safe and quality care for the patients. And these are the type of scenarios which we are using in our day-to-day life with the same. Obviously you'll get another question, difference between the countries, that is the equipments, documentations, everything is differ from country to country. So the images of equipments and documentations are clearly shown on their website, so it's better that you can refer. So it would appear some applicants don't take care when studying the images of the equipment or practice filling in the documentation, both of which are crucial. And scenarios, an OSCE station are displayed outside the station. On the same day, the OSCEs will be advised applicants to avoid getting distracted as well. And in conclusion, the majority of applicants prepare well, and definitely they will pass. They're able to apply knowledge in a safe way and give full care and attention throughout the test. And for preparation, everything like stations, scenarios, equipments, and the theoretical knowledge, everything they have uploaded in their site, so it's much easier to us to read it and get the knowledge. And the fees which is required for this test is €2,500. That's approximately 2.15 lakhs and Indian money. And of course we'll get another questions, why an applicant might fail an OSCE. So on the first 6 years of the test, 28% of the applicants on average failed the OSCE at the first attempt, and on second attempt 15% of the applicants on average failed. So that's due to lack of preparation. If we work hard, if we go through this site, definitely we'll achieve it. So yeah, that's an overall view of RCSI test or aptitude test. I hope that you all got something regarding this aptitude test. So keep going, hard work, that's the only thing which we can get success in our life. So I'll come with the scenarios later. Thanks for watching.